again, Dr. Kruchowski and Dr. Heffron here. We are going to now move down and we're going to talk about the razor's edge. So we're really looking at the ulna. So one of the easiest ways to remember which side you're on, so thumbs up is your radius. So we're going to go thumb side is radius, pinky side is ulna. Okay. So if we're on the ulna, we're going to just find our, if we're in anatomical position, okay, we're going to find our medial epicondyle. We're going to slide just distal to that. In there should be that proximal head of your ulna, so you should kind of feel that. You should be able to palpate all the way down that shaft of the ulna is very straight, hence the razor's edge, is that it's a very straight line all the way down towards your carpals. So as we get there, if we actually ask Dr. K to pronate, we're going to find the ulna on the lateral side. Thank you.
And it can even be easier to palpate if you kind of use your fingers and your thumb.
Yeah.
So take a peek at it using different hand holds.
You got it. So, and as we look at Dr. K's wrist, we'll notice that we have two styloid processes. We have the ulna styloid and then we have the radial styloid. You can see on her, and let's see on both sides. Both sides, pretty prominent ulna styloid. It's a much sharper styloid than the radial styloid. So if you come down to that styloid, palpate that, feel around it, start to move maybe even the wrist to see what pops up underneath of your hand. Feel what happens to the shaft of the ulna as you come down, and you should start to see that there's a narrowing as you come down. If you pop just off of that, so we're still moving distal away from the shaft and the head of the ulna, now we're getting into the proximal head of the ulna. And what you should feel if you do a little bit of flexion extension with your wrist is you should be able to drop down into that little pivot, and that's the head of the ulna.
Perfect.